I work in the field of medicine, specifically in pediatrics, and I think that is a little different than some other disciplines in that we encounter patients of diverse background on a daily basis. You never know who will be walking into your clinic, hospital, or emergency department. I think in order to provide optimal medical care to our patients, we have to have some understanding of the background that they come from, and that's what I've worked on for training for both medical students and residents. You can't possibly understand every cultural background or be knowledgeable with every cultural background. You can become knowledgeable about the most common ones that you deal with, but I think what's most important is that you have respect for the different backgrounds that people come from and that you be willing to ask the questions and take the time once a patient comes to you and they're from a very different background than you've worked with before. When I speak with the residents, I like to use a quote from Robert Wood Johnson that health happens where we live, learn, work, and play. It does not happen really in the clinic or in the hospital, and I think getting residents out of the hospital really demonstrates that for them. They get to work with a number of different community-based organizations who take them into different parts of the community and introduce them to different cultural backgrounds that they might encounter. We also use cultural immersion days where we take the residents out of the clinic and the hospital for half a day at a time, and we use that as a way to introduce culture. We'll have somebody from that community host an afternoon. Might be on traditional Mexican healing, it might be understanding the military, it might be on LGBT issues, and we have people from that community who come and talk to the residents. We also use food as a cultural introduction because that's a great way to meet culture.